So today let's talk about air travel in pregnancy. Very important topic, and there are a few myths about it. Few very important questions asked by the patients very often. First of all, is it safe to travel during pregnancy? Yes, it is absolutely safe to travel in pregnancy. If you are an occasional traveler, it is okay. It causes a very minimal radiation, which is completely acceptable. Then second thing is that when to travel. If you want to travel when you're pregnant, second trimester is the safest to travel, as we know that there is an increased risk of miscarriage in the first trimester, and the third trimester there can be increased risk of preterm delivery, which can be completely unpredictable at some times. The next thing is, who are the women who should not travel? So there are certain patients who have got sickle cell anemia, or who have got increased risk of formation of blood clots in the veins, or who've got anemia, that is their hemoglobin levels are low. These are the patients who should preferably not travel during pregnancy. Now, if you want to travel, what are the precautions that you're supposed to take? So number one, speak to your doctor when you want to travel, discuss with her, take a fit to travel certificate from her, because the airline might be requiring the certificate from you. The next thing is that you should always take an aisle seat so that you can walk around. You should keep doing some small exercises like moving your toes and your fingers every 30 minutes. You can take the help of air hostess if you're not aware of this. Preferably, you should use compression stockings, which you can take advice from your healthcare provider, specifically if you're going on long distance flights which are more than 4 hours. You need to keep some candies or something which you can keep inside the mouth while you're traveling, because there can be an increased risk of motion sickness, specifically for pregnant women. As we move up, there is an increased risk of dehydration, and that's the reason you should keep drinking water every now and then. These are the important points which you need to consider while you're traveling. Make sure that you take your papers which tell your last menstrual period, expected date of delivery, your medications, if there are any risk factors which are associated, so that if you need any medical help, it is readily available for you. Some women might need some injections which are blood thinners known as heparin. You need a prescription for that. You might have to start taking the injections from the day you travel and a few days more. So that might be needed for a few patients. The last and not the least is that the pressure changes when you go high up in the airplane do not affect the baby. So please be rest assured. The scanners which you pass through do not affect the baby, and you will have to go through the security checks, and they are very important. Hope all this helps. Thank you.